This learning material is created to give equal access to learners with visual impairment and those having print disability.
Hello friend. Welcome to our special corner. This is just a continuation of our previous video about stress. So, in addition, the following medical problems and concerns are linked with negative stress. Payne, et al., 2007, A. Cardiovascular problems, heart attack, strokes, hypertension. B. Gastrointestinal problems, ulcers, irritable bowel syndrome, diarrhea, constipation. C. Headaches and migraines. D. Muscle spasms and cramps. E. Anxiety. F. Jaw problems. G. Allergies. H. Cancer. I. Back pain. J. Asthma. K. Kidney disease. L. Sexual dysfunction. M. Infertility. Let's read more. Aside from common stressors brought about by our experiences, with our family and friends and our environment, loss, death, and grief also affect everyone regardless of race, gender, or age. Tal Johan, et al., 2007. Death refers to the end of the physical being of a person that is caused by an illness, aging, or an accident. Loss occurs when someone dies, or a life situation changes or ends. And grief refers to the emotional suffering caused by a loss, disaster, or misfortune. Meeks, et al., 2007. Furthermore, loss and grief may include a change in the family, changes in living conditions, the death of a friend, suicide, the death of a well-known person, tragedies in the news, and the loss of special belongings. Meeks, et al., 2007. Loss, grief, and death may greatly affect the mental and emotional health of a person. Death is part of one's life. It is irreversible and we must accept it. After the death of a loved one, grieving follows. Grieving is a normal, natural, and healthy response to loss. Tal Johan, et al., 2007. It is important to grieve, because it is also a way to release distress. Releasing bad stress from the body through different actions such as crying, may result to an ease of feeling. Grieving may also be considered a sign of the capability of a person to heal, and move on. Grieving is important and healthy to one's well-being. Let's read more. A person who is not able to handle stress may develop poor habits, that will lead to an ailing health condition. It is important for the person to develop and practice stress management skills. Let's elaborate. Grieving is most often associated with death only. But if you recall its definition, it is the suffering caused by three factors: loss, disaster, misfortune. People may also grieve after experiencing earthquake, typhoons, tsunamis, storm surges, and other natural disasters. These people may have lost their properties, and other important things needed for everyday life. People may also grieve for a misfortune such as losing any valuable material, getting robbed, or failure in an examination. People may also suffer from experiences such as separation from friends and conflict with others. Let's read more. Stress management skills are techniques that can be used to cope with the harmful effects produced by stress. One type of skill focuses on doing something about the cause of stress. Learning and using responsible decision-making skills can help solve the stressor that is causing stress. A second type of skill focuses on keeping the body healthy and relieving anxiety. Exercising and eating a healthful diet are effective skills of this kind. Meeks, et al., 2011. There are different ways on how to manage stress. Meeks, et al. Let's read them below. Use responsible decision-making skills. When faced with a difficult problem, relax and think of the best solution for it. Let's read more. If stress is prolonged and you are not able to manage it well, you may develop a mental illness. Mental illnesses are disorders that disrupt thinking, feelings, moods and behaviors, and impair daily functioning. Donatel, 2006. These disorders may be caused by prolonged stress, and mental and emotional suffering, due to various triggers. Triggers are events, conditions, or solutions that may activate a person's tendency to experience symptoms of mental disorders. A major depressive disorder. It is normal to feel sadness and grief when faced with difficult situations. However, a person may develop a major depressive disorder when depression is on a daily basis, characterized by persistent sadness, despair, and hopelessness. Donatella. 2006. Other symptoms of depression. Lack or loss of motivation. Overthinking, that others may say something bad about him or her. Lack or loss of energy. Slow to react. Difficulty in concentrating and remembering. Loss of appetite. Excessive gain or loss of weight. Withdrawal from others or feeling alone. B. Bipolar disorder. Also called manic depressive disorder. It is a form of depression, characterized by alternating mania and depression. Donatella, 2006. A person who experiences this disorder may at times feel very happy and elated, then at an instant may feel utmost sadness and despair. Other symptoms include rapid speech and racing thoughts, difficulty in decision-making, recklessness and impulsiveness, agitation, difficulty in concentrating, extreme irritability. See schizophrenia. Schizophrenia is a mental illness with biological origins that is characterized by irrational behaviors, severe alterations of the senses and often inability to function in the society. Donatella, 2006. A person with this illness may experience hallucinations or feeling of being detached and away from reality. He or she may lose the functions of the sense organs and thinks and imagine very differently than that of a normal person. Deep post-traumatic stress disorder. A person may have this disorder when he or she experiences a traumatic situation such as being abused, raped, or involved in an accident. Symptoms may vary from being spaced out tulala, extreme sadness or frustration, irritability, avoidance to people of isolation, and others. It is important to remember that mental disorder are diagnosed. Only professional physicians may determine the illness being experienced by an individual. Furthermore, it is also needed to note that the symptoms of the disorder should be prolonged and repeated. Not because a person experiences one or two of the symptoms at one time, it does not mean that she is already diagnosed with that illness. In terms of treatment and cure, a professional physician may decide on whether to give patient medication or subject him or her to routine therapy sessions.
So this is all for now. See you in our next lesson. Thank you and God bless. Reference, Lagyup, C. M. Boalacao, F. B. Jr., Madassa, M. B. Gracia, J. G. Pablico, N. C. Lanzadres, F. Sarraza, A. E. 2017. Physical Education and Health, Grade 7, First Ed. Pasig City, Philippines, Department of Education.